Chapter 14 is local anesthesia for the child and adolescent. We're going to talk about systemic toxicity and why it's more common in children than adults. We're going to talk about how to prevent that, and then describe each anesthetic agent and the benefits and risks for the pediatric population. We're also going to talk about prevention and management of postoperative soft tissue injuries in children and local anesthesia delivery techniques for children. So, local anesthetic toxicity or systemic toxicity lasts in children. Adverse reactions are rare, but one of the most common adverse reactions is systemic toxicity. Now, overdose reactions occur more frequently in children than adults, and that's because of physiological differences. So, children have disproportionately larger heads, and with their size, when they're seated in the dental chair, the child looks deceptively large, which could cause the practitioner to administer more anesthetic based on the appearance rather than the actual body weight. The adverse reactions of systemic toxicity occur within 5 to 10 minutes of the injection, and local anesthetic systemic toxicity, or LAST, initially manifests as excitation, followed by depression of the CNS, and to a lesser extent, the cardiovascular system. The initial cardiovascular system response to LAST is an increase in the heart rate and blood pressure, and then bradycardia and cardiac arrest may follow after that. So how do you prevent it? The standard scale should be used to get a child's accurate body weight, and then you want to get the child's MRD, and you want to adhere to the MRDs set for the children by the American Academy of Pediatric Dentistry. When considering MRDs for children, it's also important to consider that children's organ functions may be immature. So we only want to anesthetize the quadrants currently being treated, which is also going to help decrease the possibility of the local anesthesia systemic toxicity. For obese children, you want to use the ideal body weight index, and clinicians should never exceed the MRD's weight or age. After the injection, the patient should be observed for any of the possible toxic responses. The local anesthetic agent selection for children. So mepivacaine 3% plain is frequently used in pediatric dental offices. It does not provide any benefit to the prevention of post-operative lip or mouth trauma over the 2% lidocaine with epinephrine, and it's easier to reach and maintain the maximum recommended dose. So keep in mind 3% mepivacaine is without a vasoconstrictor. It has a higher documented toxicity report that may be due to the lack of the vasoconstrictor. So higher documented toxicity report of that local anesthetic agent due to there not being a vasoconstrictor. Bupivacaine and other long-lasting anesthetic agents are not recommended for children. Bupivacaine is a very strong local anesthetic. It prolongs the anesthetic effect, and the prolonged anesthetic effect will increase the risk of soft tissue injury. There are no procedures. So bupivacaine is the local anesthetic that lasts the longest, right? Has the longest duration, but there are no procedures in pediatric dentistry that warrant an hour and a half of pulpal anesthesia and over 4 hours of soft tissue anesthesia. So bupivacaine and other long-lasting or long-acting local anesthetic agents are not needed and therefore not recommended. With postoperative soft tissue injury, this has been reported. Statistics show 3% to 16% of the time, which is going to be self-inflicted soft tissue injury to the lip, cheeks, or biting of the tongue. After they are administered local anesthesia, they can't feel their soft tissues, and therefore they're at risk for self-inflicted soft tissue injury. So it's a significant concern for children who receive local anesthesia, and this can range from mild to severe. To prevent this, you want to select a local anesthetic agent that has a duration of action that's appropriate for the length of dental treatment. And you want to advise the parent and the caretaker of the parent or the caretaker of the possibility of injury caused by biting or chewing of the lip, tongue, or cheek. You also want to ask the parent or caretaker to delay having the child eat or drink hot beverages. Have the child eat or drink hot beverages during whenever the patient is still under anesthesia or experiencing anesthesia of the soft tissues. That's going to help prevent the injury. And it's suggested to reinforce the verbal warning of placing cotton rolls or by placing cotton rolls in the mucobuccal fold and placing warning stickers on the patient's head as well. Your book talks about just different preventative measures to take with children as far as soft tissue injury goes. Remember, they're at great risk because they can't feel their soft tissues. Another one is to administer phenylethylamine mesylate, which is Oroverse, at the end of the procedure. And basically what that is it reverses the soft tissue anesthesia when a local anesthetic with a vasoconstrictor is administered. Chapter 15 talks more in depth of the Oroverse, and so we'll get into that as well. The management of self-inflicted soft tissue trauma, so the day after the injury, if injury does happen, you want to instruct the parent or caretaker to apply an ice pack to the area. The following day after the injury, you want to instruct the parent or caretaker to place a warm pack to the lesion. Lubricant may be applied, and antibiotics are usually not necessary. The injured tissue may appear red or red with white, and typically edema or swelling is present. The techniques for children do not differ significantly from adults, but the main differences are anatomic. So the maxillary and mandibular bone in children is less dense when compared to adults, and also less needle depth is needed to reach the target locations because, of course, children are smaller. Patient preparation, the all pre-administration protocols discussed in Chapter 7 and 11 should be used. Behavioral management is essential. Word choices are critical. You never want to mention the word shot or needle, hurt, pain, bee sting. All of those trigger words should be avoided, and you never want to belittle a child. Box 14-1 in your book provides a sample dialogue to use before the administration of the local anesthetic injection. With the administration, the protocol, you want to position the patient in the dental chair, apply the topical anesthetic, which is available in many flavors, and the child can choose. Stabilization and communication, so it's important to control or limit the patient's movement. With maxillary anesthesia, you want to use shallow insertion of the needle, 2 millimeters at most with maxillary, and children between the ages of 6 and 9 receive effective pain control from the buccal supraperiosteal injections, equivalent to that of an IA block. You want to refer to figures 14-4 through 14-13 in your text for more administration protocol with the maxillary and mandibular anesthesia. So, for the considerations, it's recommended that the American Academy of Pediatric Dentistry, MRDs, be used rather than the manufacturer doses. You want to have careful consideration to the maximum recommended doses, MRDs, of local anesthetic in children who are taking opioid or sedative medications. Systemic toxicity is more common in children. Always use the ideal body weight index for obese children, and keep in mind that there's very little difference between 3% mepivacaine plain and 2% lidocaine in soft tissue duration. 3% mepivacaine plain has a higher concentration of anesthetic than 2% lidocaine and may increase the risk of systemic toxicity. This medication, the Oroverse, is an effective reversal agent of soft tissue anesthesia when a local anesthetic containing a vasoconstrictor is used. The inferior alveolar blocks are more successful in children compared with adults because the mandibular foramen is more inferior, but supraperiosteal injections are more effective in both maxillary and mandibular arch due to the less dense bone. This was a short chapter. If you guys have any questions on it, please let me know.